Afternoon and welcome to the Flint Community Webinar, your community resource. This is a special edition of the webinar. This is a Healthy Holiday edition, and we have a guest moderator with us. Our very own Yvonne Lewis is going to be directing us through this wonderful special edition of the webinar. And I know that you're looking forward to all the things that we're going to be talking about today and the wonderful speakers that we have. So thanks, Yvonne, for joining us, and everyone else, we look forward to hearing from you.
Good afternoon, Carolyn, and thank you so much for all that you've done to continue this work and all the partners that have continued to be a part of this very important webinar that gives information out to our community on an ongoing basis about health, healthy well-being, and updating on some of the major issues that are happening in our community. And of course, we're still in the midst of understanding how to remain healthy during this holiday season. We've had a number of conversations about this being healthy over the year, but here we are again. It's time for families to be gathering again, and there's so much going on as it relates to the continued exposures to COVID, influenza, RSV. And so the question continues to be, how do we maintain a healthy environment for ourselves and for our loved ones? So we're happy to have with us our team today that'll be presenting to us: Dr. Kilgore, Dr. Liroff, Dr. Wolford, Dr. Sadler, and of course, Dr. Gordon. We're just so excited about having all this information available to share with our community today. So we'll get started right away, and let's welcome Dr. Kilgore, who's going to give us some updates on COVID, the vaccine, and what's happening in the world of COVID. I mean, it's not a new conversation. It's an ongoing conversation, and yet there's so many changes. So, Paul, if you can give us a quick update.
You bet. Thank you very much, Yvonne, and it's great to be here with you all. And I'm just going to go ahead and put the slides up, and we'll get right into it, okay?
Sure.
Let's see. Okay, so you will let me know, I'm sure, if you can see the full view. Is that good for you all?
Yes.
Okay, awesome. Okay, so let's jump right into it. You know, I have some good news for you all today, and I think that that's going to be nice. But first, I do have to mention to you that, you know, COVID is still a risky disease. There's no doubt about it that we do have people dying of COVID-19 still. We have a lot of people who are going into the hospital as well. And so this is a potentially serious condition for many people. Can put them in the hospital, but could also put them in the intensive care unit. The other thing to know is that it is not just adults that are becoming affected by the disease still. We do, of course, have people in the younger age range who are actually dying from the illness. So we want to make sure we can all be protected. Now, you may remember back when COVID started that we had these different levels of activities. I still kind of adhere to this. And I think one of the things that we're all going to be doing is attending different things. We may be traveling in the airplane. But I just wanted to put it out there to be aware of your surroundings. Be aware of people who are around you. And particularly be aware of people who may have symptoms of COVID-19. And my recommendation is, in this regard, carry a mask with you. If you have an N95 mask, just have it in your pocket just in case you're in a crowded space where you know there's a lot of people around. And particularly if you're like on an airplane, I do wear a mask on the airplane, to be honest. I also wear a mask in other congregant conditions, like a movie theater or other place. And that's my recommendation just in this high season when we're kind of now going into peak COVID, plus you have flu and RSV around. This is the same slide, really just conveyed a different way. There's levels of risk going out from low to high. You see down at the bottom. And so one of these things that I always kind of keep in mind is who's around me. And recently I've been to meetings where people are coughing or have symptoms. And then sometimes I will wear the mask in that instance because you can't tell who has COVID and who doesn't. So the real news that everyone probably has heard over the past several months is that we do have an updated COVID-19 vaccine. Why are we doing this? The reason is that the original vaccines that were configured or designed for COVID-19 were really addressing the earlier strains of the disease, the virus. So SARS coronavirus has changed. It's mutated, it's evolved. I'll show you how it's done that. But the bottom line is that in order for you to get the best protection against this disease, you have to have a vaccine that's formulated with the latest strains in mind. And that's exactly what we have now. And I'll show you what that means. So, of course, the state of Michigan is really doing a great job in getting the word out. This is just a poster that they have. And one of the key messages you hear me repeat today is that the vaccine is now formulated and it's recommended for ages 6 months and up. So we can't vaccinate newborns or babies up to 6 months, but we can do 6 months and older. So that's really good news. And the vaccines are widely available. You can see here a list of the places where we can go. And I have some more information about how you can actually find a location near you in just a second. So we do know that there's a substantial burden of COVID-19 still. You know, I hate to see anyone get COVID-19 and end up in the hospital, but what I really hate is seeing people get into an intensive care unit setting where it can be very difficult to recover. And sometimes we end up seeing people not only get a viral illness, but on top of that, they get a bacterial pneumonia. And, you know, when I see a patient like that, you know, all bets are off, especially if they're older or have underlying medical conditions. It's one of the reasons why the vaccine is so critical right now. Now, I mentioned to you that the virus has been changing. That's true. It's been evolving. And if you look at the little print over here on the right-hand side, you can see the lineages and you can see the percentages. The bottom line here is that we have these Omicron, what we call subvariants or strains related to the parent Omicron. So these are like grandchildren of the original Omicron strain. And we find that out by sequencing the strains. We can see how closely related they are. You can see HV.1, JN.1, EG.5. These are just designations of the strain. And you can see, for example, now in the United States, HV.1 accounts for somewhere between 26.6 and 32.7%. Of course, there's a range around that, but the bottom line is it's an evolving virus. There's these new strains, but here's the good news. Because the new vaccine for COVID-19 is formulated around an Omicron strain, there is cross-reaction, cross-protection among the Omicron strains. So the new vaccine will protect against these new subvariants. So that's really good news. And it's just a repeat, the HV1 is been reported since last summer, but it quickly became a predominant strain and the other ones are coming up fast too. So it's a dynamic environment. Things are changing very quickly, just so you know. And that's one of the reasons why we all need to kind of be aware that the new vaccine is going to help cover these new strains. One of the things about COVID-19 and the spike protein is that it has a gazillion areas to mutate. So this is just a spike protein. These little numbers and letters here, these are places where mutations have been found to occur. So it's kind of like a glove. You put a glove on and you can put a glove on and pull it down in many different ways, you know. And in every way that you put on that glove, it can fit differently. That's how the virus can mutate, but still fit onto the ACE2 receptor. It's this receptor that it binds to on your cells. So this cell, this purple cell is you, this ACE2 receptor is you, and the virus is binding to you. And it does that through the RBD, the receptor binding domain. It means that it can really latch on hard and fast, and it does it very efficiently. It's getting better and better at doing this. So that's why we need this new formulation. I mentioned to you it's targeting the Omicron subvariants. We consider this an updated vaccine. We don't really call it a booster because a booster concept is more like we're using the same vaccine as we did before, but this is actually a new vaccine. It's a new formulation, okay? Now, will the new vaccines protect us against these new strains? Yes, there is cross protection. We do expect that to occur going forward. And right now, what's interesting is that the Omicron lineage, the Omicron family of SARS coronavirus 2 strains, that's been the predominant family over the past several months. This shows you the evolution over time, and it's quickly changing. You can see the time zone or time span from 2020 to 2023, just in the past year. You can see here that we're getting new and new strains. Almost weekly, a new strain is evolving. Why do we pay attention to this? We do think it's important because we want to know if the transmission characteristics of the virus are changing. We also want to look at whether or not there's a different clinical syndrome with the new viruses as they evolve. So that's very, very important. And we can track viruses' ability to escape the protection that you may be getting from a vaccine. There's ongoing research and studies on that. So if we do discover that the virus is able to escape your protection from a vaccine that you're getting, that's when we start triggering and start developing a new vaccine. So we're always looking and trying to figure out whether or not we need to update this vaccine. There is a SARS coronavirus vaccine network already that's been established since the pandemic. It's still carrying forward a lot of research, still going on. Now, when you see someone with symptoms of what you think could be SARS coronavirus 2 or COVID-19 infection, what does it look like? So things like sore throat, congestion or stuffiness, cough, runny nose, fatigue, headache, muscle aches, joint aches, fever, chills. Now, sometimes people may get nausea and vomiting. What does this look like? It looks like flu. It could even look like RSV in adults. So what I'm going to tell you right now is if you do yourself get symptoms that you see here on the left, or a loved one or a friend, family member, my recommendation is go out and get tested right away. You can actually get those free home tests. I don't know if you all have ordered those. You get I think it's a group of 3 or 4 tests. You order it online, and that test is free. You can get it free delivered from to your home, and the U.S. Postal Service will deliver it for free, no charge. So that's very important. You could also go out if you have insurance or other willing to pay out of pocket. You go to urgent care. They have the test frequently. They can even do a send out PCR test. So those are available out there as well. So this is the website. You can go online to order the free test. So that's easy to do, covidtests.gov. Now, what vaccines are available right now? We have Pfizer, we have Moderna, and we have a third one, which you may have heard about, Novavax. The Novavax is a different type of vaccine. It's what we call a protein subunit vaccine, whereas the Pfizer and the Moderna are the mRNA type vaccines. These are all authorized and approved, and they are available in Michigan. When we look at the recommendations by age group, I created a relatively easy table here. So everyone over 5 years of age, you get 1 dose of the updated vaccine, okay? And you could get 1 dose of Pfizer or Moderna or Novavax. If you're a child 5 to 11 years of age, or if someone in your family is unvaccinated in that age range, or they're previously vaccinated, they get 1 dose also, but only of the Pfizer and Moderna. Novavax, we don't have that recommendation yet for Novavax, so more studies will be done. People who are 12 years and up who are unvaccinated, they can get 1 dose of the updated vaccine or 2 initial doses. So if you're going to get the Pfizer or Moderna, it's just 1 dose. But if you want to get the Novavax, it's 2 doses, just because of the research and the vaccine trial design. That's what we know works. People who are 12 years and older, previously vaccinated, they can get 1 dose of the updated vaccine, and that's true for all 3 of the different vaccines. So I have a more extensive table. The bottom line for children aged 6 months to 4 years is that we have enough data to support recommendation for Pfizer and Moderna. Either Pfizer or Moderna is okay. For children not previously vaccinated, it's going to be a 3-dose series, okay? For children who are previously vaccinated, it could be, depending on how many doses they had before, 1 or 2 doses for them, okay? And this table outlines which vaccine they can get, and the spacing, of course, is there too. So the spacing is about 3 to 8 weeks. So it's nice because there's some latitude or leeway between the dosing. It doesn't have to be right on a certain day, you know, or interval. So there's some flexibility there. It is an IM or intramuscular injection that's easy to take. Upper arm for adults and older children. We do it for the thigh in younger children. And here are the vaccine ingredients. No preservatives, such as thimerosal. No antibiotics are in these vaccines. There's no other medicines or therapeutics thrown in for good measure, nothing like that. There's no tissue, such as aborted fetal cells, gelatin, or other things. There's no food proteins like egg proteins that might induce an allergy. There's no metals like you see here, iron, nickel, that kind of stuff. There's no latex in the vaccine as well. So it's not in the vial stopper. That's pretty unique. So they've done everything they can really to make a vaccine that is just purely a vaccine. Now, I have to tell you, there's always these myths out there. I want to mention a few of them just to make sure that we're on the same page. Number one, the ingredients are safe. Those that I just listed for you have been shown to be safe, and the trial data supports that very strongly, as does the post-licensure, post-approval experience with the vaccines. Very, very safe. The other thing I would say is that we know these vaccines do not cause or induce variants to occur of the SARS coronavirus 2. These happen because of the mutation, the natural evolution of the virus. It's nothing that we're doing with the vaccine. The vaccine's not doing that. The other thing I wanted to mention is that there's definitely no microchips or other electronics or magnetic things in the vaccine. We're creating the vaccine strictly to fight the disease and not to track information or movement of anyone. And the data we have now tells us that COVID-19 vaccines do not affect fertility for men or women. So you can rest assured that the vaccine is safe. Now, it doesn't alter DNA. The vaccines, even the mRNA vaccines, do not enter the nucleus of your cells where your DNA is located. That doesn't happen on a molecular basis. We know that for a fact. And we know that the vaccines in the United States don't shed or release components in the environment or outside your body. So we're protected that way. So you're not going to have like a weakened virus out there as a result of people getting vaccinated. That doesn't happen. The general recommendations I put here kind of repeat what I just mentioned, but if you have any questions, you can feel free to reach out to me. I do want to mention a couple things that people with underlying medical conditions, I strongly recommend getting the vaccine, not only for COVID-19, but for flu and RSV too. And particularly if you're in the right age group. For RSV, it's 60 and older or younger kids. These are so important because, you know, when you're immunocompromised or you're older, your immune system is still there, but it's not working quite as well as when you were younger or maybe not immunocompromised. And many medical conditions, diabetes, heart disease, chronic lung diseases, kidney disease can sometimes weaken our immune system, and other diseases can too. So we do have these recommendations for children. Know that your children can be vaccinated. The experience we have is now deep. Many children have been vaccinated, and this is a great thing to consider, especially with the upcoming holidays. Do talk to your pediatrician if you have any questions about this, but immunocompromised children are especially vulnerable, so be careful on for them and make sure they can get vaccinated. Novavax vaccine is a great option for people who don't want the Pfizer or Moderna mRNA vaccines. It uses a recombinant spike protein and a new adjuvant, very effective. So it's not the mRNA technology. This vaccine, if you have had it before, 1 dose. If you haven't had it before, 2 doses. The optimal timing you see here, I would recommend getting it right now as soon as possible before you get into the big holiday season. You can go get it right now and still get some protection over the next couple of weeks. And I would recommend it because the season for COVID-19 transmission may continue for the next several weeks to months. Can you mix and match vaccines? Absolutely, yes. It is safe. You can go Pfizer, Moderna, Pfizer, and you can also mix in the other Novavax vaccine as well. And here's the table to show that. So you can go with the initial product here. We don't now have the Janssen vaccine, just so you know, but if you did get that before, you can mix and match. You can get the Pfizer or Moderna or Novavax vaccines now. So that's great. It's really the updated. Okay. So can be vaccinated with other vaccines. COVID-19, RSV, flu vaccine can be given together. Absolutely is safe. If it's more convenient, go that route for sure, because sometimes it's easier to do that all at the same time. We do have studies showing it's safe to get flu and COVID-19 together. Co-administration of flu and the new RSV vaccine has been found to be safe in the clinical trials, so that's good news there for sure. And there is no waiting period as well. So if people want to go ahead and get the vaccine, space it out any way that they prefer, you know, a week or 2 weeks, that's okay. There's no pre-specified required time period. But if you are sick or you have moderate illness like a upper or lower respiratory tract infection or diarrhea, you might wait until you've recovered completely from that to go get the COVID-19 vaccine. And certainly, if you want to make sure that you're okay after you have COVID-19, you can wait a few months and then go get the COVID-19 vaccine after you've had COVID-19 itself. Where to get vaccinated? Pharmacies, offices, clinics. Insurance plans are covering the vaccine mostly, as far as I know. I haven't heard any stories to the contrary. You can actually look up at vaccines.gov where to find a location near you to get vaccinated. So that's handy. So a couple take homes here. Whether you choose to get the flu, COVID-19, or RSV vaccines at the same or different visit, you can do that. The most important thing is you get all these vaccines that are recommended for you and your age group and your children as well. I really think that's super important to protect the entire family. And a bonus tip for RSV vaccine, if you're pregnant or a parent of an infant, talk to your doctor about getting the RSV vaccine. It's new, but RSV is a horrible disease. I don't even want to show you pictures or videos of what people look like and what kids look like when they get sick with it. But it's out there, it's available, it's a very effective vaccine. And especially if you're 60 years and older, this is something I would strongly recommend you talk to your doctor about getting. And I would recommend getting it as well. Here's where you can go for more information. You can even text your zip code to 438-829 to get a location near you to get the vaccine, or call the 800 toll-free number 800-232-0233. And I'm just going to end here and say thank you very much for the opportunity to be here with you again. If you have any questions, feel free to reach out to me. This is my email. Yvonne or anyone can share with you. It's my phone number. Feel free to give me a ring if you need anything, okay? And I'm definitely around. So thank you guys very much.
Thank you so much. I mean, it's been a couple of years now. We've been talking about this when we first started the webinar on coronavirus to the Health of Flint Research Coordinating Center. There was a lot of information that we were hearing without real facts. And what you've shared with us today is based upon tons of research now that's been done on this, some very definitive responses to some of the questions that we received from community. So we certainly want to thank you for that information today. And again, I think the key points, as you're saying, is to make sure that we follow those protocols and talk to our doctors and make sure that we're doing the things that we need to do to stay healthy and to keep our family and friends around us healthy. So certainly on behalf of all of our partners, we want to thank you for that presentation, and sure you stay around in case we have some questions that come up in the queue. And so to follow that, Dr. Leroff is going to give us some additional information. We're going to be looking now at infection prevention, and she's going to talk a little bit more in detail about some of that and what's going on here locally and even some state and federal and national numbers. Thank you.
Yes, thank you so much for the opportunity to speak today. My name is Caitlin Leroff. I am an infectious disease physician at Hurley Medical Center, and I'm also assistant faculty member with the College of Human Medicine at Michigan State. So I hope to provide you all with some information and answer some questions that you may have today. I know there's a lot of confusion around, what current guidelines are for exposures to COVID-19 and also recommendations for, what to do if you get COVID-19. So without further ado, if you go to the CDC's website here, there's actually a very helpful calculator that can help you figure out, if you have been exposed, what the recommendations are for you specifically, or if you have COVID, what the recommendations may be for you. And as you'll see, this is something that intuitively feels like it should be simple, but is actually somewhat complicated based on the type of exposure you had, and also based on the degree of illness that you have with COVID. So again, as Dr. Kilgore went over, the symptoms of COVID-19 are broad, inclusive of fever or chills, cough, shortness of breath, fatigue, muscle or body aches, headaches, loss of taste or smell, sore throat, congestion, runny nose, nausea, vomiting, or diarrhea. And if you have any of these symptoms, it's important to get tested for COVID. And that will help inform, how long you're supposed to isolate and things like that. So the first thing you can do to decrease your risk, both of getting COVID and giving COVID, would be wearing a mask. There is increased efficacy associated with different types of masks, with respirators or N95s or KN95s lowering odds the most, surgical masks in between, and then cloth masks at the lowest end there, with no mask, of course, putting you at the highest risk of testing positive. So what to do if you're exposed to COVID? So what this means is being around someone who has known to have tested positive with COVID in a situation in which you were not wearing a mask. So if, let's say, you hear a friend of yours or a family member tested positive and you know that you had been talking to them, mask-free, you do not need to stay home unless you develop symptoms. But you do need to wear a high quality mask when indoors and around others. And this really is important because it prevents you from transmitting it to others. That is the hope anyways. Of course, the research on all of this is evolving, but these are the best recommendations that we have now from the CDC. So you are recommended to do this for 10 days, to continue wearing your mask and monitoring yourself for symptoms, with day 0 being the day of exposure, and then you maintaining that masked state for 10 days following that. Testing is recommended on day 6 or later. And if you do test positive, you enter a different sort of an algorithm. So if you test positive but have no symptoms, again, now day 0 is the day you tested, and day 1 is the first full day following when you were tested. You continue to wear your mask if you have to be around others. But at this point, if you test positive, the recommendation is that you stay home and try to self-isolate for 5 days. If you do develop symptoms, the clock kind of restarts, and day 0 then becomes the day that you get symptoms, and you're supposed to then isolate for at least 5 days after that. Following that 5 days, on the 6th day or so, you're recommended to test. And then at this point, because now we're on the symptoms algorithm, if you test positive, you stay at home for at least 5 days, and then you may end isolation after day 5 if you are fever-free for 24 hours without using fever-reducing medications and your symptoms are improving. Now, after you end isolation, you're still recommended to mask for the next 5 days. If you are not improving, you are to continue to isolate until you are fever-free for 24 hours, and then your symptoms are improving. So you may end up, after you test positive and have symptoms, needing to self-isolate for longer than that 5 days if you're not getting better. Now, the recommendations for how long you should isolate vary depending on degree of symptoms and degree of illness. So all of that, isolating only through 5 days really only is recommended if you have mild illness. Now, if you develop shortness of breath or have difficulty breathing, it's recommended that you isolate through day 10, and of course, wearing a mask if you have to be around others during that time. Now, if you have severe illness, this is if you were hospitalized for COVID. Oftentimes, this means that you required oxygen while you were hospitalized, or you have a weakened immune system. You are recommended to isolate through day 10. This is recommended because individuals with a weakened immune system oftentimes have more difficulty clearing the virus, so they may be more infectious for a longer period of time. If you do meet this weakened immune system criteria, you should consider talking to your doctor. They may recommend that you actually do antigen testing before removing yourself from that isolation. And in any of these situations, you're recommended to wear a mask until day 10. So again, just to kind of recap, if you're asymptomatic, isolate it. If you're asymptomatic and test positive, isolating until day 5 and then wearing a mask till day 10. If you are testing positive and minimally symptomatic, it's wearing a mask and isolating at home for 5 days. And then if symptoms are improving and fever-free, to then wear a mask in public for the next 5 days if you have to be in public. And then if you have moderate to severe COVID or are immunocompromised, isolating and wearing a mask until day 10. So everything requires wearing a mask until daytime. So that's a little bit about COVID. I've got about 5 minutes left here, so I'll talk a little bit about some other viruses in our community, because as COVID has entered our repertoire of kind of constant viruses, we need to not just think about it alone, but also in conjunction with RSV and influenza, as all of these viruses can result in hospitalization and decrease the amount of beds available to individuals for other things. So have to be thought of in some ways altogether. The CDC actually this week just released a health advisory that said that there were overall very low vaccination rates. And there are increasing rates of transmission of COVID, RSV, and influenza. The highest rates of transmission right now are in the southern U.S., but they are increasing in the northern U.S. And in the past 4 weeks, hospitalizations among all age groups have increased 200% for influenza, 51% for COVID, and 60% for RSV. You can see here, this is overall respiratory virus activity by state. Michigan's actually doing pretty well right now, but as we saw with COVID, these areas of transmission tend to fluctuate. And at any given time, one area might be doing well, but as we know, viruses do not respect borders. And so when we see increases in one region, we do expect increases in other regions. You can see here that in the United States, emergency department visits for all respiratory illnesses are increasing. You can see here that COVID-19 is in the orange line, influenza is in the blue line, and RSV is in the purple line, and they are all increasing. This is a graph that shows the same emergency department visits, but specifically to Michigan. And as you can see, it's similar to the national trends, we are having increasing ER visits for these viruses as well. This graph shows the percent of tests positive for respiratory viruses. And I think one thing that we need to consider when we look at these graphs is that people are testing a lot less. So these graphs do really not tell the whole story. But overall, of people we are testing these days, and that's predominantly people with symptoms, the rates of all of these infections are increasing, with RSV actually overtaking COVID for the virus that's causing the most tests positive nationally at this time. As you can see here, hospitalization rates are also increasing for influenza and COVID-19. In Michigan, you can see that they are consistent with national trends, also increasing, with COVID increasing more than influenza in Michigan than nationally. This shows the rates of RSV hospitalization. Again, you can see these rates are increasing nationally, and then in Michigan increasing as well. Here you can see that there are specific age groups that are more likely to visit the ER or to be hospitalized with these viruses than others, with older individuals and those between 5 to 17 being the most likely to visit the ER for these viruses. For RSV, you can see that 0 to 4 is far outstripping all of the other viruses for ER visits. And here you can see some trends nationally in viral respiratory deaths. And this goes from October of 2022 to the end of November 2023. And you can see that COVID is still the virus that's causing the most number of deaths in this country. Last year, there was a high rate of RSV among kids, and you can see here in December of last year, there were a significant amount of deaths caused by RSV, and that was almost predominantly in young individuals, those aged 0 to 4. This is specific to our community. I reached out to our micro lab. We use a company called BioFire to test for our respiratory viruses, and this is specific to the Midwestern region, and you can see that COVID is actually, although there are increasing rates of test positivity, it's not the #1 virus for which people are testing positive, with human rhinovirus and enterovirus outstripping COVID, and then RSV second to that. And you can see here some weekly detection rates, with high activity being defined as greater than 3%, and then medium activity as 1 to 3%. So I highlighted RSV, COVID, and influenza here. And then I'll just conclude, I'm at my final minute, but here at Hurley, what we have been seeing has been mirroring national trends. I took data from July 1st and compared it to present. It's pretty much been increasing in a linear way. But we at Hurley are not just screening all comers. We're really only testing people who are positive. But at this point, 25% of the swabs for RSV are testing positive, and 18% of the tests for COVID are testing positive. So what we're seeing nationally is also representing what we're seeing both in our state and within our own community. There has been an increase in RSV cases reported to the point that Corewell Health System is actually going to be restricting hospital visitation. Again, thinking about these viruses altogether is really important in the way that we think about hospital capacity. And vaccination rates, unfortunately, are not where they need to be. I appreciate Dr. Kilgore's lecture and would just encourage everybody to get vaccinated. I do have some other things to present, but I'll just stop there so I don't run over my time. But if anybody has any questions, they're welcome to email me. And I'm also, it looks like in the chat here, I have a question about Paxlovid. Would you like me to wait till the end to answer these questions, or do you want me to give it a shot now?
Answer that quickly now. And then the other question was, why is there seeming an increase in the RSV?
Good questions, all really great questions. So the question about Paxlovid is, yes, we can absolutely talk about it. Paxlovid is an antiviral that is recommended to decrease severe disease and hospitalization. You know, it was originally largely studied in individuals who were unvaccinated. So it was comparing rates of hospitalization and severe disease in the unvaccinated versus the vaccinated, and Paxlovid was found to reduce the risk of severe disease and hospitalization. But there have been, more recent retrospective studies that have shown that it also decreases the rate of severe disease and hospitalization in those who are most at risk for severe disease. And of course, that is those who are immunocompromised and those who are elderly. It's also safe in pregnancy. And I think that's an important point to get across, because COVID can be more severe in pregnancy than in other groups. And the only thing that I would say is that it does have significant medication interactions. So I would check in with your primary care doctor if you're interested in Paxlovid to make sure that you have no drug interactions there. And then the question about RSV, this is a good question. I think the hypothesis for the increasing rates of RSV last year especially was that children had really been so isolated that they were kind of all being exposed at once. And so usually where we had kind of a staggered exposure to RSV, we had this whole cohort that was all being exposed for the first time at once, and that was causing them to present to the ER with severe illness. I also think these days we just have, more literacy with viruses, and so people are more aware of them and talking about them more. RSV has always been a really bad virus for kids in that 0 to 4 age group. It's associated with increased rates of asthma later on. So I think part of it is, the lack of immunity that people may have had during the shutdown years. And now a catch up, and then also kind of a new literacy. But in addition to that, I would emphasize what Dr. Kilgore had mentioned, and that is that there are RSV vaccines available. You can see here, there's 2 RSV vaccines, Arexvy and GSK, that are recommended for adults ages 60 and over, and then 1 RSV vaccine that's recommended during weeks 32 to 36 of pregnancy to give immunity to babies in their first 6 months of life, as well as an RSV preventative antibody. So definitely seek those out if you are in any of those age groups. All right.
Thank you. Thank you,
Yep.
Dr. Appreciate you sharing that information. And of course, re-emphasizing some of what Dr. Kilgore had said, so it helps us to really hone in on what those critical points are. And so looking at and understanding this, Dr. Rick Sadler, who has been on our team for the HFRCC and the Flint Community Webinar Coronavirus for its inception, and also continuing to work on this data, is going to share with us some local and nationwide patterns so we can kind of see what's happening across the board. Dr. Sadler.
Yeah, thanks, Yvonne. So if you were with us during the thick of COVID, you might remember we maintained a COVID disparities dashboard weekly. And while we don't do that, I've pulled together a mix of national and local trends to help give us a kind of both a big picture and a zoomed in picture. And I put a number of links in the chat that correspond to most of the maps that I'm going to be sharing. So if you want to go explore those yourself, you can, but I'm going to try to boil this down for us in just a couple of minutes. So looking big picture, these are the death rates from COVID since the very beginning. So this is, in some ways, it's kind of a small positive for us here in Michigan. We really went out of the gate really poorly with COVID, but over time we lagged, as it were, in death rates. And so the states with the highest death rates tend to be in the South, and Michigan's kind of a little bit closer toward the middle. The COVID death rate in the last few months is shown here. And again, Michigan's kind of much more average. So we're certainly not losing the race or winning the race, I guess, as it were. The rate of new COVID hospitalizations per county is shown here. And so you can see there's a bit of a cluster in West Virginia and out through the High Plains. And there's some yellow counties in Michigan, but Genesee currently is actually still in green. So we're not in an awful position here, at least in terms of the relative hospital admissions rate. When we look at the percentage of emergency department visits with COVID in the past week, Michigan it's actually one of the higher states overall. So that's not great, but we're not at a point where we're in a substantial or a high category as compared to past points in time. Also looking over time and zooming into Genesee County, we do start to see a bit of a seasonal trend in cases. So the summer we had very few, and we've been spiking again recently, and have actually had. So I got this data from the EPIs at the health department just earlier today, and we've had 346 cases in the past 7 days, and so our last 7-day average is even higher a bit than the case or the number here. They also gave us the amount of the presence of COVID in wastewater in Genesee County, and this is from a U of M team. Again, the link is in the chat. When we line these up together, we can see that the case rate or the number of cases in Genesee County and the presence of COVID in wastewater do tend to align and have a bit of that seasonal trend. I mapped the number of cases by season by census block group, which is like a small neighborhood. And then so I modeled these for each of the 4 seasons of 2023. Excuse me. So in winter, I guess the general thing to show with these 4 maps that I'm going to share is that there's really no geographic trend anymore. There's not one neighborhood or one part of the county that's really being hit hard. We do have a couple of red spots in the city in winter of 2023, so January to March of this year. The one red in the middle also corresponds to Hurley. There's a lot of cases that wind up getting pegged to Hurley. So when you see that red on this map, that's actually just saying a lot of people have been pegged to there instead of to their home addresses. But again, we did see a little bit of red higher. So this is the number of cases per 1,000 population. So reds are more than 20 cases per 1,000. When we get into the summer or the spring, most of that pattern goes away. Again, there's a little bit of red still by Hurley. And it looks like there might have been an outbreak at the Genesee County Jail. And then into summer, basically goes away. And then with fall, it's popped back up a little bit. And we do see some of these kind of lighter red areas in the city. And then just to kind of reiterate or remark, COVID is still it was a top 3 cause of death. In 2022, it became a top 4 cause of death. And it's possible it might slide a little bit, but hey, it's still way up there. So this is important. And then also to illustrate what our death rate has been in 2023 as compared to past years, it is quite a bit lower than those peaks we saw in 2020 and 2021. And even at the start of 2022, we had some peaks that were really, really awful. So it's quite a bit lower than in the past. It is still more risky for older populations, and the racial disparities that we saw in the first 2 peaks have gone away, and the death rate among white population is just a little bit higher than the others, but they're all, again, quite a bit lower than they were a couple of years ago. And that's what I've got for you.
Thank you, Dr. Sadler. We see that there has been some progress made, but we're still in need to continue to follow the protocols and make sure that we keep ourselves safe. So thank you for giving us that update. During the Flint Community Webinar on coronavirus, we had a special highlight from Dr. Susan Wolford, which we call the medical moment. And so she is going to come today in this special edition and give us a medical moment. Dr. Wolford.
Hi, Yvonne. Oh, it is great to be back with the team here for this medical moment. And so I'm just going to share my slides here. I'm out of practice and rusty. Let's see, we have a slide here, I think, which is the one we want. And this is what we're going to talk about today. We are going to talk about mitochondrial health. So I imagine that that is a little bit of a strange topic, you're thinking, but the reason we're going to talk about it is because I wanted to bring to you some of the latest research that's out there about COVID. And one of the things I found that was of immense interest to me was the fact that some studies suggest, and now you know that when we talk about research, that it takes lots and lots of studies to actually confirm something. And it takes large studies with randomized trials to be able to say more definitively if something is the case. So these are early studies looking at patients who had COVID and went on to get long COVID or didn't go on to get long COVID, and comparing those to people who didn't have COVID at all. And what they found, interestingly, was that people whose mitochondria were not functioning as well as one might want were more likely to be the ones who had long COVID or more severe cases of COVID. So you're asking yourself right now, well, what are mitochondria? Well, I am so glad you asked. So let me show you this. Here's an image of our cells, and these little squirrely things down here are the mitochondria. And people often describe them as looking like a bean. And you know how I love my kitchen and bringing things from the kitchen. So I have some beans here in my hand, some kidney beans. This is what people say they tend to look like. But they don't all have to look that way. They can look like this sort of long, thin sausage that I have. It looks a bit dry, but anyway, this kind of long, thin shape. So they can take different shapes. But the important factor about them is that they are known to be the powerhouse of the cell. So you'll remember that when people get COVID, many times they talk about having low energy, either during the COVID, or if they go on to have long COVID, they're talking about having low energy. And one of the things that, and these mitochondria do a lot of things, and indeed, I'd like to speak about them more in the future because there's so much to say about it. But one of the things they do is they create the molecules that we use for energy, this ATP. They take the oxygen and they take the sugar that we take in and the fat that we take in, and then they do what they do, and they put out these ATP molecules that are used for energy. And that process appears to be impaired in some ways, potentially by COVID. And they can be impaired by other things. And so the idea is that if you have healthy mitochondria, maybe you will be more likely to be able to weather the storm with an infection such as COVID. So I know you're saying to yourself now, well, how do I have healthy mitochondria? So there are lots of things that we can do. And as I tell you about how you make them healthy, I want to talk a little bit about how they act in the cell. So as I said, they go on, their major function, although they make many things, is to make these molecules that we use for energy. And in so doing, you'll get some nice large beans like the kidney beans. And they'll actually, sometimes the long ones will link together. They're like social beings. They don't like to be sometimes they don't want to be socially distanced. They want to be together and benefit from being together. But then sometimes when things are not going as well, they get to be smaller, and we're not really sure what that smaller, why they get to be smaller. Does that help them survive adverse circumstances, or is that a sign that they're going to be dying off more easily? Lots to be learned in this space. However, some of the things that we know help them to be able to do what they do well, to link together when they need to make more of themselves because they replicate. And you want lots of good, healthy, plump mitochondria in your cells. One of the things that you can do to do that is to exercise. Now, you know I was going to go there, right? So apparently, as we use our muscles, and I have my weight here, as we use our muscles, our body realizes that we need more energy and makes more mitochondria. So I know you're all sitting there now trying to move your muscles, which I'm hoping you're doing, because just by doing this, we are making those healthy mitochondria that can help us be ready to fight off illness. Another thing you can do, I am sure you are guessing it already, but I have to pull out my hearty favorite apple. Yes, an apple a day keeps the doctor away, and this might be the way it does it, by nutrition. But one of the and we'll get back to this in another one at some future date when I can tell you more about the nutrition part. But one of the interesting things about nutrition and mitochondria is that actually being a little hungry helps. So I'm not telling you to starve yourself. I'm not telling you not to eat, but I am saying that if you are a little hungry, it's not a bad thing. So maybe put some spacing between your meals and not snack as much, but maybe put 4 or 5 hours between a meal. That little bit of being hungry, and we don't know how long you have to be, but we know that being a little bit hungry helps your mitochondria to be healthy. Remember that? Being a little hungry helps your mitochondria to be healthy. And finally, on the idea of how to help your mitochondria be healthy, I have my little sleeping eye mask here to show that healthy sleep, and one day we can talk in more detail about how the healthy sleep works, but healthy sleep will help your mitochondria to be healthy. And I used this to illustrate the sleep because it's really important that you are in darkness. So if you don't have a dark room, if you're like me, there's a light from a local store shining in through our bedroom window. If you can't make your room dark, put on your eye mask so that you're in darkness. And of course, don't have your computer light on like I often do. You want that darkness so you can have the right production of melatonin so you can sleep well and have your healthy mitochondria. And finally, I'd like to say, when we think about these mitochondria, as I say, they're like the energy house. And they think people often talk about them as having the fire, like being a fire. And I have it here on my holiday plate because it's the holiday season and we have a candle. But if we do all those things, if we exercise and be a little bit hungry and eat the right foods, and we sleep well, then our mitochondria, rather than just putting out a little bit of energy, because we have few of them, we'll have more healthy ones, and it will be a flame of energy. Nobody will be able to stop us. And with that, I'm going to hand back over to Yvonne.
Thank you, Dr. Wolford, showing us what we can do to help our own body be healthy during this healthy edition, just to make sure that we follow again some really basic things. Let's get some exercise, let's eat well, and let's sleep well. And then, of course, if there's medication needed, as we talked about the vaccines, if they're accessible, that's one of the key things that we want to make sure that people know where they can go. Once we do what we can do, we want to get a little help. We need to know where we can go. And so we're thankful for Dr. Gordon being here with us today from Michigan United, who will talk to us a little bit about what's available in community. So when we talk about the social determinants and one of those things being access, we're going to address that access issue. So Dr. Gordon.
Good afternoon, everyone. We do have several vaccination clinics coming up. The health department on December 19th at 12 p.m. to 2 p.m. They will be at Our Lady of Guadalupe Catholic Church, 2316 West Coldwater Road, and it's going to be COVID and flu vaccination for all ages. And also Wednesday, December 20th, 9 a.m. to 11 a.m. They'll be at the Genesee County Health Department, 63 South Saginaw Street, inside the McCree building, the second floor. Again, COVID and flu vaccination. So one new thing that's about the vaccination that wasn't before is that now you might have to present your insurance card, because there is a charge if you have insurance that is covered. But the CDC offers a program called the Bridge Program for those that are uninsured to make sure you're able to get vaccinated. December 21st, we will be at New Creation Church of God on 3472 Linden Road, Flint, Michigan, with Big Brothers Pharmacy. They will be offering flu, COVID, RSV, and pneumonia. So that will be 9 a.m. to 1 p.m. at New Creation. You'll be able to get all those vaccinations, and it will be all ages as well. So we have been doing vaccination pop-up still, and we have been, the biggest thing is the access. Again, as you stated, with the rollout, it was a little bit slow for access, but now we're having a good turnout at our vaccination clinics, and they have 3 clinics, so you have plenty of time to get vaccinated before the holiday season to keep you and your family safe.
So beginning on the 19th from 12 to 12/19 is?
December 19th at Our Lady of Guadalupe. There'll be 12 p.m. to 2 p.m. And then again, Wednesday, you have 3 days in a row for this year. Wednesday, December 20th, will be at the Genesee County Health Department, 630 South Saginaw Street, inside the McCree building, from COVID and flu all ages. And then New Creation Church of God. There will also be a food pantry, but there will be flu, COVID, pneumonia, and RSV vaccines available.
Thank you so much, Dr. Gordon. Know that there are places, so we're trying to reduce the disparity, improve access. All of this is important. So thank you for sharing what will be available to our community members. And
Thank
so on behalf of the Healthy Flint Research Coordinating Center, partnering with Michigan State University and this wonderful team, Dr. Jennifer Edwards Johnson, thank you so much for continuing to carry the torch along with Dr. Uphold. Appreciate all that you're doing and look forward to continuing opportunities to share with our community. So Dr. Edwards.
Thank you so much. And it's so good to share the screen with you again. So good to see you, Dr. Wolford. Your medical moment was such a reminder of how awesome you are. So thank you so much. Thank you to everyone for joining in with us today on this really important webinar. Thank you to all of the panelists. Shout out to Dr. Gordon for all of your wonderful resources. Thank you to Dr. Kilgore for all of your important information. We are so excited and happy to be able to bring you this information that you needed to hear. Please continue to let us know about important things you want to see on the webinar. As we think about last things, oh, I'm getting some background noise. Hold on. I don't know what is happening. Hold on. I just want to make sure this is quiet. All right, I can hear you better. My apologies. I wanted to let people know that as you go into the holiday season, make sure you are thinking about getting into your primary care doc to make sure you're getting the resources you need. We look forward to seeing you soon. And lastly, don't forget to get your CE units for community